where news comes first. This is ABC-7 Extra.
Welcome to ABC-7 Extra. Good evening, I'm Stephanie Valle. For the next half hour, we're talking about healthcare in El Paso, whether it be your ability to access care or how the various healthcare networks in El Paso are trying to cater to your needs. We're talking about it. And tonight, we'll be hearing from several of our area's leaders in medicine from the private and public sectors. I want to start, though, with the topic that made headlines last week, the request by the El Paso County Hospital District Board to the county that would funnel hundreds of millions of taxpayer dollars to University Medical Center. My co-anchor Eric Elkin has extra depth.
Up to $400 million of your taxpayer dollars. That's what could be spent by the county hospital. What's it for? The short answer, University Medical Center is looking to use the money for expansion purposes. The Board of Managers of the El Paso County Hospital District voted unanimously in favor of bringing this to county commissioners, which they did on Thursday. The county hospital asked the commissioners to approve the publication of notice, which was ultimately tabled until June 27th. But let's take a deeper dive into what kind of expansion UMC is planning. This is part of the presentation that was given to commissioners this past week. Included among the 35 slides is this one, a master plan that breaks down potential costs. The grand total is nearly $350 million. About half of that goes towards UMC capacity expansion, including renovating the third floor North Tower for 23 ICU beds, adding surgery expansion with 3 new operating rooms. Roughly $40 million of that is to create an ambulatory procedure center, which includes 6 operating rooms and 2 procedure rooms. About $37 million is budgeted for expansion of El Paso Children's Hospital. Then there is nearly $80 million earmarked for the creation of a cancer institute. And finally, about $55 million for property and land acquisition to include current Texas Tech properties adjacent to the existing campus. But how this is all paid for is where it becomes controversial. The board is asking commissioners to approve a publication of notice. It's looking to use certificates of obligation. That's what allows governmental entities to issue debt without voter approval to fund any public project. So how does that impact you? Well, a project of this scope would affect the property taxes you pay. UMC is one of the 5 taxing entities in El Paso. In the board presentation, they estimate the impact on El Paso homeowners would be about $55 on a $100,000 home per year. So on a $200,000 home valuation, you're looking at more than $100 extra per year in your property taxes. And that's just on the initial amount the hospital is asking for. During the presentation, it was noted the Fed interest rate hike on Wednesday would impact the potential cost. And here's the other issue coming to light, transparency or lack thereof. All of this information was first reported by a blog called El Paso News. The amount of certificates of obligation was not published on either the county commissioners or the hospital district's meeting agenda, nor were there attachments with more information. The hospital board has also not been broadcasting its meetings since shifting to virtual meetings during the pandemic. The last video was posted from March 2020. And they don't post the meeting minutes either. UMC says it only has to make them available if someone asks for them through an open records request, which can take up to 10 days. While the county commissioner's meeting agenda did not have any details initially, so many local reporters asked questions, including us. The presentation slides were finally posted Wednesday afternoon, less than 24 hours ahead of the commissioner's court meeting.
Here's extra depth on what UMC is asking for in the funding request and why. Increased capacity to treat burn patients, most of whom are transferred to Lubbock and Galveston. Also, a clinic for older adults as well as an urgent care center in central El Paso to meet the need of that area of town. Hospital officials tell me the hospital has grown and it has to respond to the demand for care. There was a time when 50% of its patients had insurance and 50% did not. UMC says due to its quality care, now 70% of its patients have insurance and 30% do not. And the hospital adds it maintains its focus is to provide affordable care for all, regardless of their ability to pay. Joining me now in studio is the Chief Executive Officer for UMC, Jacob Cintron. Thank you for being here.
Thank you for having me.
So, Jacob, certificates of obligation are debt taken on by taxpayers without their approval. So why choose this route rather than taking this to voters in the form of a bond election?
So a couple of reasons. First of all, the certificate of obligation does allow us to be able to access bond funds to be able to make improvements to our facility, whether it be equipment needs, expansion needs. and it requires the approval of the county commissioners, which are elected by the public, versus a general obligation bond, which will take a longer period to establish. It requires a public vote. And given that the interest rates continue to rise, the certificate of obligation process is a little faster, and therefore the calculation is that you save a lot of money, anywhere from 75 to $100 million in terms of debt service by going with a certificate of obligation versus a general obligation bond. And the certificate of obligations are designed for this very purpose, to allow taxing entities like Commissioners Court to be able to approve using this vehicle, which many organizations use, in order to be able to make improvements where timing is critical.
Okay, so you would get the money faster, but that doesn't necessarily mean that the work would be done immediately. You would still have to get the materials, you would still have to get the employees or the staff to create all of these projects, and that could take a long time, which would also add to the cost. So again, why not just maybe include it in a bond election so at least the voters could have a say?
So what happens is when the certificate of obligation, say it were to be approved by the county commissioners, then we're able to encumber those funds at a set interest rate. So once you get those funds, yes, by the time you get architectural drawings done, you go out to bid for the construction work to be done, and the actual work is completed, there is that time element, but the funds that were encumbered for this bond are set at a interest rate. So clearly, if the expectation is that the interest rates will continue to climb, you're able to lock in those funds at a lower interest rate. And that's what creates the savings.
So UMC is funded by taxpayers. There was a question about transparency in this, that this was not posted, the attachments were not on the agenda. Why not be more transparent, give taxpayers and commissioners more time to know about this request and be able to weigh in on it? So
the process of facing some of the capacity constraints we were dealing with had been discussed for the last couple of years. And quite frankly, we had discussed it with our commissioners, we discussed it with our board. And at the time when we were thinking about going for a request for a certificate of obligation funds, COVID hit. And with COVID, we saw that, businesses were closing, people were losing their jobs. And we thought at that time that was not the appropriate time to go for that. And now, we're still in COVID. We're not out of the woods yet, but it has somewhat stabilized. Nonetheless, what we're facing now is a supercharged economy. Home prices have really gone up. You see salaries have gone up. Job positions remain open for a long time. Cost of the things that a hospital does, for example, in terms of, pharmaceuticals, implants, and so forth, has also gone up. So, the issue then is what's facing our taxpayers is my home value has gone up, so my taxes are going to go up. And now we're looking at this bond that would also increase. Now, the truth is that, from the transparency standpoint, we had talked to our board and to our commissioners sometime. We didn't act on taking action until this last week when we met with our board. And what the board approved was the ability for us to ask our commissioners to allow us to post notice. It was not to approve the strategic plan. The board had approved the strategic plan about maybe 30 to 45 days before. And what the authority to ask to post notice, all that does is it starts the clock from a minimum number of days before commissioners can take a vote. So by posting notice, it lets the public know we're interested in pursuing a certificate of obligation. You have to wait a minimum of 45 days before any action can be taken on it. And during that time, we're afforded then the opportunity to engage with our stakeholders, with our communities, to explain why we need this. And then they have the opportunity to talk to their elected officials, whether it be through public comment or direct communication. And then the commissioners, at the end of the day, are the only ones that can approve any kind of financing, be it through a certificate of obligation or to authorize us to go for a general obligation bond.
Speaking of the commissioners, you often, every year around late summer, approach Commissioners Court with a budget for the hospital to be approved. Why is this certificates of obligation request coming maybe a month or two before the budget is submitted to the commissioners. Why couldn't some of that money be included in the general budget?
So the general budget really deals with maintenance and operations and some of the routine capital items that we normally include. This bond typically is fairly large. So what it does is it's two really different things. You could go for a certificate of obligation really throughout the year, almost at any time. When we look at our discussions with the county commissioners and our board for our annual budget, that normally is a process that takes place during the summer with the intent or goal to have our budget approved sometime in September. And what that budget is for, it deals with, for example, the maintenance and operations component of our hospital, with a little bit set aside for routine capital expenditures. So the bond itself, the getting up bond funds normally is done through a different process, not through that process, be it a certificate of obligation or a general obligation process.
Jacob Cintron, the CEO for University Medical Center, thank you for being here today.
Thank you for having me.
You're watching ABC-7 Extra. Coming up, I visit with two leaders in El Paso healthcare. Texas Tech University Health Sciences of El Paso marked 10 years of training nurses, and now they're training the next generation of dentists. That's later in this show. But first, the big plans for Sierra Providence Health Network and its campuses across El Paso.
What's the word on the street? Taco Cabana is serving up new carne asada street tacos with fresh cilantro and onion. Carne asada, new at Taco Cabana. Get together and try it today.
That's a pretty tight spot.
Watch this.
Your Buick Park said so. That's so you.
Of course you know where we're going. That's so you.
Kinda got a sixth sense.
And a head-up display.
They're here.
You brought all these players in your Buick?
Yeah,
So you.
it is.
At the heart of every Buick SUV is you. Pay no interest on Buick SUV models.
Sierra El Paso, Las Cruces Buick dealers.
Think all senior care is the same? Think Bien Vivir. As El Paso's only all-inclusive senior health program, you can expect a community of friends, your own team of healthcare providers, a healthy nutrition program, and therapy that improves your quality of life. We can even fill your prescriptions, all under one roof and with no out-of-pocket costs. So enjoy your independence and leave your healthcare needs to us. It's not too good to be true. It's Bien Vivir. Call us today.
News doesn't stop on the weekends.
Breaking news. Several people shot at a party in Socorro.
With the only weekend morning newscast in the region and up-to-the-minute breaking news coverage throughout the day.
Those 6 victims are being treated here at UMC.
You can count on ABC-7 to keep you and your family safe and informed.
I just told my girlfriend just keep running.
When news breaks, with online alerts and updates on your phone and at kvia.com. ABC-7, complete coverage of breaking news every single day.
What could make a Taco Cabana burrito even better? Yep, that'll do it. New smothered burritos with your choice of sauce. Only at Taco Cabana.
Welcome back to ABC-7 Extra. I'm Stephanie Valle. We're talking about healthcare in El Paso. I'm here at the Hospitals of Providence Memorial Campus, and I'm speaking with the CEO of the Hospitals of Providence, Nico Tejeda. Thank you for joining me today.
Thank you for the opportunity to speak with you.
The last time we spoke, we were in the middle of the pandemic, and COVID-19 was running through this community. The hospitalizations were very high. The hospital had to make a lot of adjustments to make sure to be able to accommodate a lot of the COVID-19 patients. We are still in a pandemic, but I understand that hospitalizations are not nearly as high as they used to be. Is that the case?
That's absolutely correct. You know, at one time it seems like it was a long time ago. On the other hand, it seems like it was just yesterday. But at our peak in the Hospitals of Providence, we had around 450 COVID positive patients in our hospitals. Today it was around 20. So a markedly different situation than we used to be.
The last time I was here, you had described that a wing of the hospital had been sectioned off and was being redesigned to accommodate the patients to have the outflow of air and whatnot. So how is that wing now being used? Is it still for COVID patients?
No, that's a great question. Across the nation, hospitals here in El Paso, And everywhere you looked, we're finding old units that they haven't opened for a long time and opening those units for COVID positive patients. Since, fortunately, there aren't COVID patients, we've been able to close those units, shutter them, and if we ever need them again, they're there. But for now, those units are no longer being used.
So they're not being used by COVID patients, but are they being used by other patients?
No, well, I'll take the Memorial Campus as an example. This hospital is capable of serving nearly 400 patients, over 400 patients. But any given day, we probably have anywhere from 200 to 250 patients in the hospital. So those beds remain empty, and that's a good thing for the community. We want people to stay out of the hospital and stay well.
So what do you anticipate being on the horizon when it comes to a major health issue? Like I said, we're still not out of the pandemic, but it does seem that hospitalizations have remained low.
Yeah. You know, I have the fortune of sitting on the board of directors for the American Hospital Association, so I get a chance to see what the trends look like nationally and locally as far as our next challenge that we're all going to face. And that next challenge is on us, and that's a staffing crisis that all of our nation's hospitals face, and it's no different here in El Paso. There was a mass retirement of nurses, also a huge migration of nurses from the hospital setting to other healthcare settings outside of hospitals. We're probably several years away from being able to replenish our nursing workforce to where we used to be before the pandemic. Because of that, you have fewer hospital beds that are available for patients nationally and locally. So we're working with our nursing school partners and others to solve that problem, but it really is a crisis, and that's just for nursing. You also have the same problem for other healthcare professions, respiratory therapy, radiology. So that's really where our challenge lies moving forward.
So unlike, say, a county hospital where they take in people regardless of their ability to pay, does the inability to provide staffing per bed, does that change your ability to treat patients?
You know, it's interesting, for the Hospitals of Providence and for any hospital, we actually accept every patient that comes to our doors, and we welcome them. So we all have the same set of problems. If we don't have the staff, it becomes a challenge to take care of those patients. Now, fortunately, we've been all able to solve that problem by hiring staff from outside the community. But moving forward, we really like to have all staff that are here local and not hire people to come into town to provide that assistance. So it's a challenge we all face, and we all serve the patients who come through our doors.
The Hospitals of Providence is celebrating a 70th anniversary of serving El Paso. How is the hospital network honoring that tradition?
Now, I appreciate you asking that question. You know, it's been 70 years since the Memorial Campus, once was Providence Memorial Campus, was created. I was looking just for fun. 70 years ago, a couple of notable things happened. One, Singing in the Rain came out. But even more, Queen Elizabeth became Queen of England. I didn't know that. That was 70 years ago.
That's right. She had her Jubilee.
Yes, she did. So a little, almost as important as that was Providence Memorial was started. And that really began a chain of events that you've seen over the last 70 years become something incredible. I don't know that El Pasoans really know how fortunate we are that a number of people over many decades invested so much to making this health system what it is today. If you look at it today, yes, the Memorial Hospital campus is 70 years old, but you have nearly 60 access points throughout El Paso that's really dedicated to serving this community. And if you look at history, if you look when this hospital was built, it was only dirt surrounding it. If you look at when our East Campus was built, there was only dirt surrounding it. Look at Trans Mountain Campus on the northwest side. There's still only dirt surrounding it. We invest where El Paso is growing so we can help El Paso grow. And the story remains the same today with what we have planned for the future.
So talk about what is planned. What is next? What's the big investment?
Yeah. So if I look right now, you have a number of things going on. Here at the Memorial Campus, we just finished the renovation of our labor and delivery department, and we're about to begin the renovation of our neonatal intensive care unit. If I look at the Sierra Campus, which is our heart and neuro hospital, we've done a number of investments there. Trans Mountain Campus, which I think is fascinating, it's not so much an investment in bricks and mortar, but rather in people. We have introduced residency programs in partnership with Texas Tech, and that's training the next generation of physicians here. And of course at the East Campus, that's where a lot of activity is happening, because of course the East Campus is located in one of the most densely populated zip codes in the United States. So there, we just finished opening up a brand new fancy operating room with biplane technology. We're about to open up a $20 million expansion that adds many, many beds to the hospital. And then we're looking at additional investments in farther East El Paso as well.
So just for example, at the end of the month, there's going to be a ribbon cutting on the third floor expansion. Can you talk about that expansion to the Far East campus off of Joe Battle?
Yeah, so it's going to do a number of things there. So the way we look at the community tries to be forward-looking. So when we built that hospital in 2008, we knew that it was going to expand and the community was going to expand, even though it was just surrounded by dirt. So we built additional empty space at that hospital for this day. Matter of fact, this is the reason I moved to El Paso 7 years ago, was to help expand the East Campus Hospital. And finally, we're at that point. And it's going to do a number of things. It's going to expand critical care capacity. We've heard that recently, that our community lacks critical care beds. This is going to add a number of those beds. It's going to add an operating room for women who are giving birth, which is another thing we desperately need. It's going to add more beds for patients who are being monitored for any heart conditions. These are the things it's adding on at that campus that community desperately needs in East El Paso.
Where are these investments coming from?
So what's amazing is that Hospitals of Providence is a part of a large healthcare system called Tenet Healthcare. And Tenet Healthcare is from coast to coast in many, many major markets, from Los Angeles to Florida to Boston to Detroit. But historically and today, this is the most important market to the company for a variety of reasons. But Tenet really believes in this community. So every single dollar investment, and over the last 20 years, it's been over $1.1 billion in the last 20 years alone. Every single dollar comes from our parent company, Tenet Healthcare, for the benefit of the community, which we are very proud of. There's no taxpayer burden on that, and we're the largest private employer in El Paso, and we're amongst the largest taxpayers in El Paso. Do
you feel like that could be a concern when it comes to making sure that the healthcare needs of El Pasoans is being met?
Yeah, absolutely. These things have to be seriously addressed, and we are seriously addressing them. I'll give you an example. We saw an opportunity to better find a way to attract graduate nurses to our community and to our organization. And we've made a number of changes in the last few months, compensation adjustments, and this year we're on pace to hire twice as many new nurses as we did last year. And every healthcare system in El Paso is doing that, because we have to. But what we can't do is we can't simply have nurses shift between hospitals and hospital systems. What we need to do as a community is train more nurses and attract more nurses from outside the community to come to El Paso, because then we can actually start increasing the total number that we need to take care of all the healthcare needs that we have here.
All right, Nico Tejeda, the CEO of the Hospitals of Providence, thank you for talking to me about all of this today. I appreciate it. This is ABC-7 Extra, and after the break, I'll be talking with Texas Tech University Health Sciences Center of El Paso about their nursing school, as well as they're taking a bite out of dentistry.
When it comes to safety, who has more IIHS Top Safety Pick Plus awards? Subaru. When it comes to longevity, who has the highest percentage of its vehicles still on the road after 10 years? Subaru. And when it comes to brand loyalty, who does J.D. Power rank #1 in the automotive industry for 3 consecutive years? Subaru. It's easy to love a car you can trust. It's easy to love a Subaru.
Maintain the love of your new Subaru with 2 years of complimentary maintenance.
And now, most admired alum.
Get up there.
This is so embarrassing.
There's no way it's me.
You know her. You love her.
Ruh-roh.
What are you doing here?
It's Anna Gomez.
Who?
Our first gagillionaire. With AT&T Fiber, Anna's got the fastest internet with hyper-gig speed.
I didn't know you went to this school.
We have a lot in common.
Live like a gagillionaire with AT&T Fiber. Now with speeds up to 5 gigs. Limited availability.
Press play on summer savings today at Oscar Leaser's Hyundai of El Paso. We're stocked for summer with the vehicles you want, like Elantras, Tucson, Santa Fe, Santa Cruzes, and even Palisades. All available with zero down. That's zero cash out of pocket. And interest rates as low as 2.79% APR for 60 months. Stop by and check out the all-new 2022 Ioniq 5 electric SUV in stock. That's an electric SUV in stock today. Press play on summer savings today at Oscar Leaser's Hyundai of El Paso.
We know you count on ABC-7 to keep you informed.
Our Alert Center brings you breaking news as it happens.
We put our experience to work for you every day.
Finding stories you won't see anywhere else in Texas and New Mexico.
We make it clear and understandable.
Bringing you extra context, depth, and perspective.
Our team is always tracking.
And first to alert you to any important weather changes.
ABC-7, where news comes first.
The team you know,
the team you trust.
Welcome back to ABC-7 Extra. I'm Stephanie Valle. Tonight, the topic is healthcare in El Paso. We've talked to the leaders of University Medical Center and the Sierra Providence Health Network about the changes they're attempting at their facilities. And now let's talk about Texas Tech University Health Sciences Center of El Paso. Leaders, along with administrators and students at the campus in South Central El Paso, celebrated the 10th anniversary of the Gail Grieve Hunt School of Nursing. Since it opened its doors in 2012, nearly 1,100 nurses have graduated, and a majority have stayed in El Paso and helped to reduce the nursing shortage here. Many of them, including nursing students, worked to help El Paso's COVID patients during the worst of the pandemic. During the anniversary celebration in May, the school managed to raise nearly $2 million for scholarships for nursing students, many of them from El Paso, some of them young, but others pursuing a second career. Another focus is growing the dental school. The Woody L. Hunt School of Dental Medicine opened almost exactly 1 year ago. Nearly 40 students make up the first dentistry class. They have 60 in the second class starting in July, and when fully populated, they will have 240 dental students. Campus officials say those first-year students saw 3,000 patients as a part of the instruction and training. Dr. Richard Lang, the president of TTU HSC of El Paso and the dean of the Foster School of Medicine, tells me they're preparing for their next class of future dentists.
Now, when it's fully staffed, we'll be able to take care of about 60,000 patients a year here in El Paso. But the fact that that first year took care of almost 3,000, that's almost unheard of. Most first-year dental students don't do that. But we train them in a way so that they're proficient to do that very early.
So when you're saying they're treating patients, where are they seeing these patients?
Well, we're seeing them in a brand new dental clinic. And in full disclosure, Stephanie, I was the first patient they saw.
Really?
And my wife is also a patient. They've done such a fantastic job. The education center, so they learn the skills in a simulation lab, working on mannequins and teeth prosthesis. And then once they become very proficient, then they move those skills to the clinic, so they become progressively better. It's a clinic that has about 140 different operatories, some individual chairs as well, or operating suites. It is literally the most state-of-the-art facility in North America. It's all CAD/CAM, so all the goopy stuff you used to have impressions you put in your mouth and make these things, we don't do that anymore. We do an oral scan with a camera, we transmit it to a computer, we design on the computer what your crown or your tooth should look like, we mill it or 3D print it, and it's available to insert later that afternoon. So it literally is state-of-the-art.
And finally tonight, a look at another option El Pasoans have when it comes to healing. The latest big development for Las Palmas del Sol Healthcare came with the acquisition of Highlands Rehabilitation Hospital in East El Paso. It is now Las Palmas del Sol Rehabilitation Hospital East. Patients at the rehab center can receive both inpatient and outpatient services.
The El Paso community is growing at an accelerated rate, and that growth also brings the need for additional healthcare services in our community. We're bringing high-quality rehabilitation care close to home for residents in East El Paso and surrounding areas.
The renovated rehabilitation hospital opened to patients last December. Thank you for joining us tonight. I'm Stephanie Valle, and this has been ABC-7 Extra.